key takeaway from this consensus statement is that heart transplantation is a viable and life-saving option for select patients with cardiac amyloidosis. Hello, my name is Melissa Lyle, and I'm an Associate Professor of Medicine and Advanced Heart Failure and Transplant Cardiologist specializing in amyloidosis at Mayo Clinic in Florida. I'm the first author on the article entitled Heart Transplantation for Cardiac Amyloidosis, the Mayo Clinic Consensus Statement. Outcomes are comparable to non-amyloid transplant populations when careful multidisciplinary selection is applied. This consensus document provides a comprehensive, multidisciplinary guidance on evaluating and managing cardiac amyloidosis patients for heart transplantation. It outlines clinical phenotypes, risk stratification tools, organ involvement assessments, and both the pre- and post-transplant management recommendations. Importantly, it emphasizes the role of early referral as well as appropriate screening of patients being considered for transplant. We also emphasize the need to phenotype AL amyloidosis patients specifically, given a different approach is needed when someone presents with a new diagnosis of AL amyloidosis and cardiogenic shock versus someone who is stable and potentially can be followed to determine if there is organ recovery. The Mayo Clinic approach is focused on our integrated multidisciplinary care model. This involves transplant cardiology, hematology, neurology, nephrology, GI, and more, all really working together to individualize the transplant candidacy. And this real-world experience across all Mayo sites underpins our evidence-informed expert consensus recommendations. This guidance helps clinicians recognize when and how to refer cardiac amyloidosis patients for heart transplant evaluation. It also offers practical tools for risk stratification, imaging and biomarker thresholds, and discusses when to observe versus when to proceed with that transplant evaluation. We also address frailty, nutrition, and organ involvement, all which are crucial in that daily transplant decision-making process. For patients, this consensus means clarity and hope. In the past, many were told that they were too sick or not candidates for transplant. But today, with advances in therapy and better transplant outcomes, select patients can live longer and better lives. The recommendations also ensure individualized care, reducing those unnecessary delays or a premature denial of transplant. Future work needs to focus on post-transplant outcomes, particularly in those patients with ATTR amyloidosis. How do we manage their disease-modifying therapies to prevent extra cardiac progression in the future? And additionally, prospective studies validating our phenotyping and risk models will further help to refine the transplant selection process in amyloidosis. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.